Lots of people throughout the world suffers from different thyroid disorders. As well as examination of thyroid gland is a must know for any examinee of any discipline of medical science. In this video, I will discuss few things regarding thyroid gland examination. And before going to the main discussion, it's time for front page picture. This poster was made to protest violation against doctors in their working places. Here in Bangladesh, every day we come to know that somewhere doctors have been assaulted in their workplace. Maybe this scenario is similar in many other countries, as well as this scenario may be applicable for other professionals too. So, I demand safety of a professional in their workplace. So I think you guys have subscribed my channel, and thank you for subscribing, and let's begin our today's journey. Thyroid gland examination. The disclaimer: these pictures are taken from Hamilton Bailey's demonstration of physical science, and here you can see two pictures, and the left one there is a solitary thyroid nodule, one single nodule over that region, and in right picture you are seeing that the whole thyroid gland is enlarged. Okay, the thyroid can be solitary or the whole thyroid gland can be enlarged. Okay. Now, before you start your examination or while you are greeting your teacher as well as the patient, you will look the patient as a whole and you will get clue mostly regarding the functional status. Like your patient may be sitting still or composed, or he may be moving constantly his or her fingers. Okay, he may be sitting still or he may be moving his or her fingers, and he or she may look nervous and agitated, or he or she may be emotionless. Okay, or he or she movement of her will be slow or ponderous. So these clues will be there, and that will guide you to know about the functional status also. Okay, so don't miss to look at the clues. After that, you will look at the faces of the patient, and that faces will also give some clues also. Like in that picture, you are seeing that there are thinning of hair. Okay, the hair has become thin, and in the outer aspect of the eyebrow there is loss of hair. Both eyebrows there is loss of hair. Okay, as well as the cheeks are flushed. The cheeks are flushed and having a pink orange tinges, and as well as there is smooth and pale yellow colors complexion. That is called as peaches and cream faces. You are also looking at the periorbital region, and that is swollen. We call it periorbital edema. And if you look clearly, that you will see that the patient is looking sleepy and also lethargic. So that faces is more commonly found in a hypothyroid patient. Okay, so don't forget the faces actually. And look at the faces. That lady is looking that she is anxious or she is very agitated. Yeah, and there are some eye signs also. She is nervous, agitated, and eye signs. Okay, look at the eyeballs. Yeah. Okay, so you have looked at the patient as a whole, as well as you have found some findings in your faces. Now you start asking the repo that, okay, I am Dr. Anuj, I am a final prof examinee, and I need to ask some questions, as well as I need to examine you. Throughout my procedure, I will not give any pain or I will not create any discomfort. If you feel some pain or discomfort, please let me know. I will take the action. Then take the permission. Shall I start? Okay. After that, you will turn to your examiner. Then if she is a female, okay, if your patient is female, you will turn to your examiner, sir, I need to maintain the privacy, and for that reason you will need a female attendant also. Why privacy? Actually, in thyroid examination you need to expose up to upper chest or upper part of breast also. That's why the privacy will give comfort to the patient and the exposure will be more comfortable. So don't forget to seek privacy and a female attendant if your patient is female to examine the thyroid gland. Clear? After that, the question session will be started. You will ask that, okay, what problem has bound you to come to the hospital? Then he will she tell that, hey, yeah, I've got a lump in my neck. Okay, then you will ask about the duration, and the next question will be, when have you first seen the lump and what was the size of that lump at that period? তো এই সময় কত বড় ছিল? Then you know that there is a swelling, but you don't know that swelling is thyroid or other swelling. The swelling can be anything. Okay, that can be a lipoma also, that can be a lymph node also, that can be an hemangioma also. So first few questions will guide you that it is swelling. Then you will like to know that what is the type of the swelling. For that reason, you need to examine first. Okay, then you will start inspection and you will ask for deglutition. Okay, then you will be confirmed that yeah, that swelling is thyroid maybe. After that, the few questions regarding thyroid swelling also, that the progression of the swelling. The swelling is rising rapidly or it is growing slowly. Okay, then also the multiplicity you may ask. Then after you have found that the swelling goes upwards while deglutition, then that is thyroid. Now ask some questions regarding thyroid. The question may be his house. Okay, you know the thyroid is endemic in few regions. In Bangladesh also, রংপুর জোনের মানুষদের কিন্তু থাইরয়েড সমস্যা বেশি হয়. Okay, so in everywhere the thyroid is endemic in few regions, so you need to know that from where he or she has come. Okay, then does he or she take any medicine for this disorder? Usually thyroid problems, if the patient has got some functional displacement, they may be taking anti-thyroid drugs or thyroid hormone. Okay, so that information will be helpful for you. Okay, and then you will ask about them some problems, that pressure symptoms, like if the thyroid gland is very large, in that particular case you may ask this question, or in that particular case that question is mandatory. But in a small swelling, small solitary lump, if you omit this question, that will not be there will be no punishment. But in a large swelling, if you miss this question, that can be a punishable offense. Okay, so the pressure symptoms like dysphagia or any discomfort, dyspnea. Okay, the pressure symptoms. Then the functional status. First of all, that does she or he get any problem to the exposure of the cold or hot, the preference to hot or cold also. And next will be her or his weight loss history and appetite history. Okay, the appetite is good or bad, or does he or she has lost some weight also. So appetite and weight loss history, very important. And then you will ask that whether he or she has underwent any invasive investigations like FNAC. সুই দিয়ে আপনি কোনো পরীক্ষা করেছেন কিনা. So I think that questions will touch every aspect of a thyroid gland. So these questions are minimum questions. Okay, there are lots of questions. So if you want to ask all the questions before starting examination, that will be a misconception, I think. So First ask few questions regarding the swelling, then ask few questions regarding thyroid swelling. Then while you are examining, palpating, or you are inspecting, in the meantime you ask the questions. That will save your time. Okay, otherwise your time will be short.